Hello, Lele. My name is Delano Carroll Jr. I'm a master's student in the School of Social Work at Hawaii Pacific University. My research project is titled Evolving and Better Understanding, Improving the Quality of Care for Hawaii's Homeless Population. The purpose of this qualitative study is to examine the strengths and weaknesses in Hawaii's homeless system of care through the views of local service providers. Collaboration is a key component to any successful team. Being able to easily share and pass on information creates a sophisticated cycle of communication that the service provider and client partnership benefits from. Homeless individuals come comprised with a myriad of simultaneous needs that are often unable to be met by one service provider alone. An intensive literature review was completed that was composed of over 35 different sources. These sources were composed of information regarding homelessness in Hawaii, intersectionality of homelessness, housing programs in Hawaii, food banks and food assistance programs, shelters, housing, housing first, low income housing, employment and education support, and medical and mental health care resources. There were limited results and findings for specific research regarding Hawaii homelessness and the collaboration between service providers. The research design for this study is an exploratory qualitative design. A complete analysis was conducted by creating semi-structured interviews with 68 individuals who have worked with the homeless population in Hawaii within the last 2 years. This sample size was selected because fewer than 6 participants will not provide sufficient breadth of information, but greater than 12 participants is likely to lead to saturation. These interviews were conducted using an interview script to collect data on the participants' perspectives and experiences in order to understand how collaboration impacts service providers and the possibilities to better service the homeless communities. After the process of translating and coding each conversation, three concise themes emerged. These themes included resources, community, collaboration. According to the participants, resources were vital in order to help serve the clients that they had. However, subjects reported that these resources needed to come in different forms. Participants shared that staffing was an issue, not enough staff, or the employee turnover rate was too high, lack of vouchers for housing or subsidies, shelter space availability, proper facilities for clients' needs, funding for certain programs, and basic overall supplies for a functioning facility. One participant shared when speaking about a case she was a part of, the resource wasn't available at the time. We received the support, but at the same time, the resource just wasn't available. The term community was defined as support from the local surrounding communities, the support from the government and state, and the support from other service providers in the community. Many participants shared that there needs to be a stronger communication effort for the community and service providers. Many organizations are opening and closing, and there needs to be a way for everyone to know what is available for them. More than 50% of the participants mentioned the need for community in a sense of Hawaiian culture and traditions. The it takes a village idea. In order to make a greater impact on the homeless population, it will take all community support and effort with the help of service providers to make a change. The third theme to emerge from the data was the need for collaboration. All participants shared a time that when they felt fully supported by another service provider and a time that they did not feel fully supported. One participant mentioned that as service providers, we are so overwhelmed with getting things done. We have to focus on, at least in my opinion, we have to focus on in every aspect of the client. We are spread thin and it makes it hard for us to provide adequate services in a quick manner. All participants mentioned CES, Coordinated Entry System, and HMIS, Homeless Management Information System, as key service providing hubs that they encountered. The reviews on these two entities were mixed and offered both positive and negative interactions. One participant said, I think CES is like a platform that has brought a lot of service providers together. Contact information on there, they're just quick and they move quickly. They have a time frame on things. While another participant shared, I would say quite often there was a lack of supportive services for clients in specific realms, quite often, maybe 40% of the time. Through this study, we have potentially found areas of improvement in the system of care for Hawaii's homeless population. Although there are current communication hubs like CES and HMIS presently being used, there is a margin of error and room for improvement. Building and creating more resources for service providers to use, encompassing the support of the local communities and improving the collaboration efforts amongst service providers would create a better network and improve the quality of care for Hawaii's homeless population. This study met limitations upon completion, which were anticipated. The study only focused on services and experiences from service providers in the state of Hawaii. All work experience with the target population only dated back to the last 2 years. These interviews were completed with service providers who are only from Oahu and part of the Hawaiian Island chain. This is by no means a complete study. This qualitative study is recommended for further research based on limited findings and multiple biases. One of social work's biggest populations is the homeless population. Social workers can learn from this study by understanding that there are occupations out there that need improvements and that they can provide new insights to these programs. Social work is a growing field that does not get advocated enough in Hawaii. Emerging social workers will benefit from this study by understanding that there are areas in the system of care that we can help improve. I believe social work can make an impact on the improvement of collaboration and communication efforts amongst service providers and really strengthen the rapport with the inclusion of surrounding communities. Hello, Pito, and thank you for listening to my research project, and I hope that you enjoyed this presentation.